Well, I'm joined now by Dr Valerie Schwoebel, who is from the Union, to talk about the TITI study into children under 5 living with people who have TB in 4 African French-speaking countries. So thanks for coming to tell us all about this. So why did you pick children under 5?
Well, children under 5 are especially at risk, both for being infected at home because they live very close to their parents, and also they are at very high risk of getting active TB and mostly severe diseases.
So what did you do with these children? What was the focus of your study?
So the focus was to demonstrate that implementation of contact investigation at the home of the patient recently diagnosed with pulmonary TB can be done, and that preventive therapy can be offered to those children.
And what kind of preventive therapy was that?
So in 3 of the 4 countries, the preventive therapy which was offered to the children was a shorter treatment with 3 months of rifampicin and INH, as opposed to the usual general regimen which is used, which is 6 months of isoniazid, which was used in one of the countries.
Did you look at anything to do with hygiene or spreading the disease in that way, and why not?
There is no point in doing this, because when you come to a family where a patient has been diagnosed, usually he has been coughing for several weeks or even months, and if the risk of being infected it was previously. So there is no point in bothering the family with those kind of measures.
And what kind of results did you have? So how much did you manage to reduce the transmission of TB to those children?
So as soon as the patient was diagnosed, the children were evaluated for the presence of active TB, and we found 5% of them having active TB. They could be put on treatment right away, first of all. And second, we could enroll 90% of the other children. They are free of active TB and they could get the preventive treatment. And 92% of them could complete the treatment successfully without any active TB being detected among those children.
So you think that this should now be standard practice? And what are your hopes that this will become standard practice in countries with TB?
It is already strongly recommended by WHO to offer this treatment for all children who are exposed at home to TB. So the problem is that it's not completely widely implemented. There is a large gap in this. And with this study, I think we can demonstrate that it is really feasible and acceptable to do this in the context of the health system and the program, the TB program, and that the short regimen, which is now recommended by the WHO with a 3 months only, as opposed to 6 months, is as effective and as acceptable for the families.
So the WHO is already recommending this, your study is recommending this. Why is it not being taken up?
I think it will take time and people will have to be convinced, but there is really a hope for shorter treatment everywhere in the TB community. So I hope with this study will contribute to this.
And it's not quite finished yet, the study, is it? What do you still have to do?
Also, we still have to complete the follow-up of the children. They will be followed up until 12 months after treatment completion to get sure that they have not got active TB. Usually the children develop active TB in the first 4 months, in the first months of infection, but we want to be sure, so we want to complete the follow-up.
So you're very happy with the results?
Yes, I think it's very hopeful result for any context of high TB transmission.
Well, Dr. Schwoebel, thank you very much for talking to us.
Thank you.